Good evening, and welcome to another edition of the Rankin Mon Valley Pittsburgh section of the National Council of Negro Women. My name is Patricia Bluette, and I am the section's correspondence secretary. Joining me today is Alice Paler Jones. I'm sorry, Paler Days. Sorry, Alice. And she is a member of our section's political committee. We thank all of you who have participated in our previous program, and we hope you will be joining us again today with your questions by calling 412 853 8206. Our guest today is Dr. Adolja. He is a senior scholar at Johns Hopkins Center for Health Security. This program today satisfies one of the National Council of Negro Women's national mandates to educate women about health and promote health care access. Today's program will also support the National Council of Negro Women's Good Health Wins, which is the Women's Immunization Network. Before we begin the show today, we would like to introduce our special guest by reading his bio. Miss Alice, I'm turning that over to you.
Welcome, Dr. Adolja. Dr. Adolja is a senior scholar at the Johns Hopkins Center for Health Security. His work is focused on emerging infectious diseases and pandemic preparedness and biosecurity. He also served as an external advisor to the New York Health and Hospital Emergency Management Highly Infectious Disease Training Program, and on a U.S. Federal Emergency Management Agency working with the Group on Nuclear Disaster Recovery. During the COVID-19 pandemic, Dr. Adolja served as a member of the National Collegiate Athletic Association Coronavirus Advisory Group. He has testified before the U.S. House Foreign Affairs Committee and the Pennsylvania House Health Committee. Dr. Adolja is also a Pittsburgh-based infectious disease, critical care, and emergency medicine physician and a native of Butler, Pennsylvania. Welcome, and thank you for being on the program.
Thanks for having me.
Okay.
We'll start
Doctor, yes, we'd like to ask your first question. Are we any closer to knowing what is in the COVID-19 vaccination?
We've always known what's in the COVID-19 vaccination. The COVID vaccines are the main ones are the Moderna and Pfizer vaccines, which are mRNA-based vaccines, where the genetic material for the spike protein of the coronavirus is included, coupled with a fatty little particle that allows it to be absorbed by your cells. That's the main vaccines that most people have been vaccinated with in the United States, and we've always known what's been in those vaccines.
Okay, thank you.
Okay, and Doctor, what happened to the monkeypox and the Omicron variant?
So monkeypox, or Mpox, is a virus that's still circulating. This is something that was a major problem in Africa and continues to be a problem in Africa and countries like the Democratic Republic of the Congo. What we had was a major outbreak in the United States when this virus found itself in a sexual network, and it spread pretty prolifically in the United States and other countries. But people changed their behavior when they understood how this was being transmitted, and we got vaccination into a lot of the high-risk group, and that stopped this virus from being a major issue, although there is still a trickle of cases that are occurring all around the country and outside of Africa. The key thing with Mpox or monkeypox is to really address this at the source, where it spreads from animals to humans, and to get vaccine to parts of Africa where this is an endemic virus. The Omicron variant, the second part of that question, is the version of COVID that's been spreading. So that's continued to spread. So it's over 2 years old. All the new variants that we've seen since about November of 2022 have been Omicron variants. So the current version of the virus is an Omicron variant. So it's still the dominant form of COVID-19 that people are getting infected with.
Okay. And what type of animals carry the monkeypox?
So it's likely rodents, so small animals like rats and other types of ground mammals like shrews. We don't quite know exactly what it is, but it's likely a rodent type of exposure, and it usually was infecting children that might come into contact with that animal. And what happened was with this outbreak that happened in the United States and other parts of of Europe was this somehow started to be spread sexually, and that's what caused that explosive outbreak. But normally it's children playing with or interacting with rodents that are likely what this happens. The whole name monkeypox is kind of a misnomer because it was discovered in monkeys, but the monkeys weren't the original host of it. But that name basically stuck. It's really more of a rodent virus.
Ah,
Okay. My question is, does having side effects mean that the vaccine is working? And if so, what does no side effects mean? And can
So
you also explain what the side effects are?
So when you get any type of vaccine, it's very common to have some pain where you've gotten the shot, have maybe fevers, chills, muscle aches and pains, kind of feeling fatigued and tired. All of that is the result of the immune system being stimulated by the vaccine. And that's what vaccines are designed to do, is to stimulate your immune system so that you're protected when you come into contact with the real thing that you're vaccinating against. However, if you don't have any side effects, that doesn't mean it didn't work. So if it's there and you have those side effects, you can be sure that your immune system is recognizing the vaccine. But if it's not there, some people just don't react very well to the vaccine. So I wouldn't say that that's evidence that the vaccine didn't take. But if you do get those symptoms, it is a good sign that your immune system is recognizing it.
hmm. Well, do I really need a booster shot if I've been fully vaccinated?
I think that depends upon your risk factors for severe disease. So if you're a 25-year-old with no medical problems, not overweight, probably not going to get very much benefit from continuing to get updated COVID-19 vaccines. But if you're somebody that has risk factors for severe disease, maybe you're above the age of 65, you're pregnant, you have asthma, you're obese, you're overweight, diabetic, you have some immunocompromising condition. So maybe you've had a transplant or you're on steroids or you have sickle cell anemia, those types of things, you would really want to stay up to date. So I think it's really good that we target those boosters to high risk individuals rather than having healthy people worry about those boosters. They're probably not going to get much benefit from it. But what we want are high risk people. And too many high risk people have not gotten the vaccine or gotten the boosters, gotten the updated vaccines, and that's what's ending up with what's landing them in the hospital. So when you see people in today in 2024 in the hospital with COVID-19, it's usually a high risk person that's not up to date on their vaccines.
Okay. Will there ever be a COVID-19 vaccine that covers all the coronavirus variants?
That would be kind of the holy grail if we were able to develop a vaccine that was able to cover all of the variants. And there are groups that are doing research trying to find a way to make a vaccine like that. That is the hope, but right now that's not going to be something that we see probably for the next 5 years or so. It's very, very difficult to do that. They've been trying to do that with influenza for decades and have failed. So it's not an easy task.
Okay.
Well, how safe and effective are second booster shots, and are there side effects to getting a fourth dose of the vaccine?
So the vaccines and the updated shots and the boosters are all very safe. And the side effects you would expect are very similar to what you had with the initial version of the vaccine. So as I said earlier, pain where you got the shot, muscle aches and pains, fevers, sometimes chills, fatigue, very similar to what you had. So the symptoms that you had when you got your first two shots are very similar to what you're going to get with boosters and any subsequent shots. And they are they're very safe. The effectiveness, I think, is what we were talking about earlier, that they're really good at prevention of severe disease, hospitalization, and death. So that's why it's really important for high risk people to take advantage of these updated shots rather than low risk people. And just a couple of days ago, we saw a CDC recommendation for this spring for people above the age of 65 to get another shot. That's something that's really targeted towards high risk people. So the effect or the benefit of it is really concentrated in the high risk group.
So what should the time frame be between getting your first shot and your second booster shot?
So four
What's
4 months is what we usually recommend people wait to make sure that so they've had some time for their immune system
Okay.
to wear down a little bit so that they actually get a benefit from it. If you give it early, it's not going to hurt you, but it may not benefit you at all. So 4 months is what we like to wait between doses of the vaccine.
Oh, okay, good. Mhm.
Now we're going to go on to RSV. I remember years ago, only little children seemed to come up with this illness. So, what is RSV? Where did it come from? How do you contact it? And who is most at risk for RSV?
So RSV is a virus that's been around for a very, very, very long time, thousands of years. It was discovered in the 1950s, and it's a respiratory virus. So you get it just like you get COVID or you get get influenza through coughing and sneezing and uh, not washing your hands and touching your face or your nose, saliva. All of those. It's a respiratory virus. And yes, it's traditionally been thought of as something that little children get, but that's not been the case. It's not never been the case. Anybody can get RSV. It's just that little children are the ones that were traditionally thought to get into trouble. So it's the most common cause of hospitalization in infants. And everybody by the age of 2 gets RSV. And then you get it multiple times during your life as an adult, and it's fairly mild. It doesn't really cause much other than cold-like symptoms. But once you get to above the age of around 60 or so, it does have the ability to cause severe disease in adults. And that's not always been appreciated, but it's always been occurring because we don't often test adults for RSV. So RSV is something that is dangerous to the very young and the very old. It kind of makes the letter U. So the problems are at the very young, that the high levels of hospitalization at the very young and at the very old. Just like flu, they very young, very old. That's what RSV, that's where the burden is. And RSV in older adults hospitalizes or kills almost on the same level as influenza. It's just not appreciated. So that's why it's so important that we've had these vaccines. This is the first season we've had RSV vaccines to really address this problem that's been neglected for decade after decade.
Okay.
Well, is there a new outbreak of RSV? And are there known cases of RSV in Pittsburgh?
Well, there's always cases of RSV in Pittsburgh. This is a virus that's always spreading. It's always occurring. It's one of the whole swarm of respiratory viruses that people get infected with. Right now, we're kind of at the tail end of the RSV season. RSV season is kind of in the winter is when you get the most cases. So if you look at the data now, the RSV cases have sort of tapered off. They're still occurring, but yes, we did have an RSV season. It was pretty brisk here in the Pittsburgh area with big spikes in hospital admissions and hospital testing, especially at Children's Hospital, but it also infected adults as well. But now we're sort of tapering off as we move into spring.
Well, what are some of the symptoms of
So
RSV?
the symptoms of RSV are just like any other respiratory virus. You wouldn't be able to tell, and I wouldn't be able to tell if someone had RSV, had influenza, or had COVID. So you're going to get runny nose, cough, maybe some shortness of breath, fevers and chills, muscle aches and pains. They're indistinguishable, all of these respiratory viruses. There's no way to tell them apart without a test.
Oh,
Okay.
okay.
How severe can RSV symptoms become?
RSV symptoms can become very severe. So if you're somebody that gets hospitalized with RSV, you can go into respiratory failure, you can have pneumonia, you can need to be on a ventilator. They can become really, really cumbersome. RSV probably kills around 15,000 Americans above the age of 65 every year. And as I said, it's the most common cause for infants to be hospitalized. So the symptoms can get very severe. In the average person, someone maybe my age, it's usually like a common cold because I don't have any high risk conditions. But in someone with high risk conditions or someone that's very young or very old, the symptoms can be extremely severe.
Okay. And how can we protect ourselves against catching RSV?
So this is a respiratory virus, so it's hard to avoid it. If you're socially interacting during respiratory virus season, this virus is likely going to be something you encounter. But what we have this year, this season, starting in 2023 into 2024, are a whole bunch of new tools. We have vaccines that are approved for older adults above the age of 60 that protect them not from getting RSV, but protect them from the complications of getting RSV. So it keeps it kind of as an upper respiratory infection rather than a lower respiratory tract infection. So there are 2 vaccines that are available for older adults above the age of 60. We also have a vaccine for pregnant women that we give to pregnant women that allows them to immunize the fetus. so that when that baby is born, it's protected through its first months of life, where it's at very high risk because of the antibodies that go through the placenta after the mother got vaccinated. There's also an antibody that you can give young children as well that protects them. So we have a lot of different ways for the first time to protect people against RSV, and I think it's only going to get better as we get more and more products developed. But these are the first tools that we really have had to make a dent in RSV.
What are some of the first symptoms of RSV? What should we be looking for?
Well, the first symptoms are going to be just like any common cold: runny nose, muscle aches and pains, maybe a sore throat, maybe a little bit of wheezing or a cough. Those are the symptoms that are going to be kind of a clue that you might have RSV, but you aren't going to be able to tell that apart from COVID or influenza or any of the other dozen or so respiratory viruses that cause these types of symptoms.
Well, should children and adolescents get vaccinated against the COVID-19?
I do think that children and adolescents at least should get their primary series against COVID-19. So that doesn't mean that they necessarily have to keep getting boosters, but they should at least get the initial series so that they have some level of immunity in them. And if they are high risk, so if that child has asthma, if that child is obese, if that child has diabetes or sickle cell or whatever it might be, then I think they need to keep up to date with it. They're high risk. So I think a healthy child, I would just have them get the routine stuff. And then after that, probably not much more. But if they have any high risk condition, they should be keeping up.
So at what age should they start getting the vaccinations?
Well, they should start getting them at around 6 months of age. You can start to get the vaccination. It should be a routine part of childhood immunization, that you get your COVID vaccines just like you get that whole slew of other vaccines to protect you through childhood.
Oh, okay.
Okay. Now, with the RSV, if it's like a common cold or the flu, how does a person know that they should go to the doctor and have it predict what they have?
You can't without going to a doctor. You can't tell any of the differences. You could do a home test for COVID, and that tells you whether or not you have COVID. And there now are home tests for influenza. They're a little bit expensive, but there is a home influenza test. You could do that as well if you had access to it. But it's really hard to do that. You can't really do that without getting a test, that specific test for RSV, and there is no home RSV test.
Okay. Okay. Can a vaccinated person spread COVID-19 or the monkeypox?
So a vaccinated so the COVID vaccine doesn't protect you from infection from COVID. You can still get COVID. It's just going to be less mild. It's going to be milder than if you weren't vaccinated. So yes, you could be a vaccinated person and get COVID and then spread the COVID. So the vaccine is more about protection against severe disease, not so much about infection. In the early days of the vaccine rollout, before this virus mutated so much, the vaccines did protect you from infection. So it was very unlikely that a vaccinated person would spread the virus because they couldn't get infected. But after the Omicron variant appeared, the vaccines became more about protecting against severe disease than against protecting against infection. So yes, a vaccinated person could spread COVID-19 if they got infected with COVID-19. Monkeypox or Mpox, much less likely that a vaccinated person would get the virus and spread it. It could happen, but it's not very common that a vaccinated person is the driver of Mpox. It's usually unvaccinated individuals that are driving Mpox transmission.
So some of us have already received the two vaccinations and the booster shot. Some of us have even gotten a fourth shot. So is it true we may have to get the booster shot every 6 months or so to ward off the virus?
I do think if you're in a high risk group, every 6 months or so might be the norm until we get better vaccines. So if you're above the age of 65, if you have any immunocompromising condition, if you're obese, you're diabetic, have cardiovascular disease, have lung disease, all of those types of people are likely going to need more frequent boosting. If you're somebody that's healthier or younger, probably not. So it's really going to be risk-based based on what your risk factors are for severe COVID.
Oh,
Okay. Now, can anyone have a second or third dose with a different vaccine than they did
Yes.
from the first one?
Yeah, you can. You can mix and match. You can get Pfizer and switch to Moderna, and there's also a third vaccine called Novavax. Yes, you can mix and match, and there may be some benefit to mixing and matching because they all have subtle differences that stimulate your immune system in different ways. So I got my initial doses with Pfizer, and I got a Moderna booster. So you can do that, and I think that there probably is some benefit to doing it.
Okay.
Well, are there special considerations for vaccinating people who are immune compromised?
Yeah, if you're immunocompromised, you have to remember that the vaccines are going to help you, but they're not going to give you the same benefit because your immune system doesn't react to them as strongly as someone who's not immune compromised. So, a vaccinated person that's immunocompromised still has to be careful when they're in crowded, congregated places, when they're around people with COVID, because they are still at risk for severe disease. The vaccine maybe decreased their chance of severe disease, but they still have a significant chance of severe disease. And immunocompromised individuals need to be sure that they're staying up to date with their vaccine. So they're not people, if you're that if you're immunocompromised, that you're not a person that should be skipping out on a booster. And if you're immunocompromised, you also should have a really low threshold to call your doctor if you get sick. Make sure you get tested and get an antiviral like Paxlovid.
Okay. Now, how many booster doses of COVID-19 vaccination does a person need?
It all depends upon their risk factors for severe disease. So just as I said, if you're immunocompromised, the number is really, there's no real upper limit. You're going to need them pretty frequently as your immunity wears off. So that could be a whole bunch of them. You might need 5 or 6 and continuing to get them into the future. If you're a low risk person, you probably don't need any because your risk for severe disease is pretty low. So it all depends on your risk factors. It's not one size fits all. It's really something that needs to be precision guided based on the risk factors that a person has for severe COVID.
Okay. And what were
Well,
the risk factors again?
So things like being above the age of 65, having any lung disease, heart disease, kidney disease, diabetes, being overweight, being obese, being pregnant, being immunocompromised. Those are the bigger cluster of risk factors for severe disease.
Thank you.
Well, some people have gotten all of the shots and are still testing positive for the virus. So, what are some of the methods that can prevent us from continually being infected with the COVID-19 virus?
It's very hard to be completely impervious to this because this is one of the viruses that's everywhere. It's just like all of the other common cold and influenza viruses that are always circulating. So if you socially interact, there's always going to be some risk that someone passes the virus on to you. So I would say if you're somebody that's high risk, be really mindful of that when you're socially interacting, especially in indoor crowded places, that this virus is there. This is not something you can really avoid if you socially interact, just like you can't avoid the common cold when you socially interact. These respiratory viruses thrive on social interaction. So what you can do is be careful. You can wear a mask if you're someone that's at high risk when you're socially interacting in indoor settings, but it's something that is extremely difficult to avoid just because it's sort of part of life now.
Mhm. Okay. What's the difference between COVID-19 and SARS-CoV-2?
So SARS-CoV-2 is the virus that causes COVID-19. Just like we say, the influenza virus is what causes flu. So it's just it's the name of the virus that causes COVID-19. COVID-19 is the disease that causes SARS-CoV-2. Just like human immunodeficiency virus is the cause of HIV, which is also the cause of AIDS. So it's the virus and the disease.
Okay.
But we are in trouble.
Yeah.
Is it safe for people who are pregnant or breastfeeding to be vaccinated?
Yes, it is safe for pregnant or with the COVID vaccine. It is safe in pregnancy and in breastfeeding, and it's actually recommended that pregnant women be vaccinated because that's one way to protect the baby when it is born is to be vaccinated when you are pregnant because those antibodies that are generated by the vaccine will pass through the placenta and protect the newborn.
Oh,
Yeah.
okay.
The same is true for influenza. The same is true for the whooping cough vaccine. There are some vaccines we don't give to pregnant women, but influenza, COVID, whooping cough, really important that pregnant women stay up to date and get vaccinated.
Hmm.
What are the current recommendations following exposure to someone with COVID-19?
The recommendations are sort of changing right now, but the things that I would recommend are to be alert to symptoms that might be occurring and have a very low threshold to test yourself. And if you have any risk factors for severe disease, you should get Paxlovid if you develop symptoms and test positive. But you should also know that you could be contagious and you might want to test yourself several times, especially if you're going to be around any high risk individuals, because you don't want to spread it to a high risk individual. So it's really about being vigilant. Some of the official guidance would be to wear a mask. A lot of people aren't doing that, but I would say if you've been exposed, just monitor your symptoms and test at a very low threshold, and be very careful if you're going to be around any high risk people, and probably wear a mask in those situations for about 10 days or so until you clear. But usually people are going to get sick within 2 to 4 days. So you could do antigen tests every day, and that can help you understand whether your exposure is going to result in infection or did result in infection.
So should people stay home from work or from school when
So
they
what I would say is that people should, if they definitely develop symptoms, they should stay home. If they have no symptoms, they could wear a mask and go to work.
So you said pay attention to people that are high risk. How would you recognize someone who is high risk?
He is, I believe he has frozen on the screen.
Oh, why is that?
Something's wrong with his computer or something. Alice, or not Alice, but Gladys, is there anything that you can do? You send him a text, maybe? I find that really interesting. Oh, there you are, doctor. Go ahead. Ask your question again.
Okay. When you were speaking about exposure to someone with COVID-19, how would you recognize that someone has COVID-19 or they're at high risk to stay away from them?
Sorry, can you repeat? I missed that. I had a little bit of Wi-Fi problem.
You were saying about
yeah. So if you're somebody that right, so we know that COVID-19 is a deadly virus if anybody has risk factors. So it's really important if you've been exposed or if you have COVID that you're mindful of that. That when you're around somebody, maybe your grandmother, maybe you're going to visit a friend in a nursing home, or one of your friends has had a lung transplant, you need to be very careful about that. You don't want to spread it to those individuals because it's not.
But how would I recognize the symptoms in someone who has not been vaccinated and may be?
Well, even if they've been vaccinated, they could still have COVID. Remember that. But what I would say is you should tell people, you're coming to, if you're a high risk person, you should say, don't come over if you've got any kind of cold-like symptoms. Or if you are, you're going to meet outside or you're going to wear a mask. That's what I would tell people.
Okay. Well, what are the current quarantine or isolation requirements for anyone that's tested positive?
So those just changed today. The CDC just released new guidance today, and it's going to be very similar to what we have for influenza and what we have for RSV, which is that you stay home until you've gone 24 hours without a fever and you're feeling better and you're not taking any kind of ibuprofen or Tylenol. So very similar to flu. So it's until your fever is gone and you're not taking any medicines and it's been 24 hours since the last fever and you're feeling better. That's the isolation guidance.
Okay.
Now, what you just said, if you're not taking any medication, so are people diagnosing themselves and prescribing medication for themselves, or?
Definitely people are diagnosing themselves. That's what home tests allow, that they can take a home test. And people do take, just like you do for the common cold, people take ibuprofen, people take acetaminophen or Tylenol, people take NyQuil and Dayquil. All of that is normal. You can't take Paxlovid without a prescription, but you can take some of those other medications. And people are used to self-treating themselves for respiratory infections, and a lot of people do that. But remember that when you're counting your fever, if you're taking Tylenol, you're taking ibuprofen, that's going to reduce your fever. So you want to see, am I having fevers? Is this masking the fever? You want to make sure that your fever is gone and that you're not needing those before you start to interact with people.
So is COVID-19 still a reportable disease?
It is still reportable, but it's still reportable in certain circumstances, but it's not something that the official numbers are really that important anymore. We're less focused on reporting number of cases than reporting number of hospitalizations, reporting numbers of deaths from COVID, and keeping track of the variant. So less so of that, keeping track of the daily case count in Allegheny County or whatever it might be. That's not really a good way to get a gauge on what's going on.
We appear to have a caller on the line. Hello. Okay, the caller is not there. The question they have is,
I can answer that in the chat.
Yes, can you answer that question, please?
Yeah, so there's a question that we got in the chat that says, what is Paxlovid? So Paxlovid is an antiviral medication that works against COVID-19. So this is a pill you take and the purpose of this pill is not to prevent you from getting, not to prevent you from getting sick, not to prevent you from being contagious, but really to prevent you from having to need to go to the hospital. It prevents severe disease. So Paxlovid is something we prescribe to high-risk people. So those risk factors I said earlier, being older, obese, cardiovascular disease, lung disease, kidney disease, diabetes, pregnancy, that's where we're talking about using a drug like Paxlovid. So we use that to keep people out of the hospital. So Paxlovid is an important thing. If you have any risk factors for severe disease and you're within 5 days of your symptoms start, this is something you should be asking your doctor for, that you need Paxlovid because you have a risk factor for severe COVID and now you've tested positive for COVID. So that's what Paxlovid is. So it's a really great thing because it does make COVID a much more manageable infection, makes it much less likely that you need to go to the hospital and it makes it much less likely that you get very ill. So this is something that's not used enough in high-risk people, but you should use it. If you test positive and any risk factors, start bugging your doctor to prescribe that.
So it's not over the counter.
Go ahead, Carol.
It's not over the counter medicine. It has to be gotten from your doctor.
Yeah, it's not over the counter. You can get it from your doctor, and you can also get it from certain pharmacists. Pharmacies can also, the pharmacist at the pharmacy can also prescribe it as well.
Oh, okay.
Now, should you actually go into the doctor's office if you're having symptoms, or are they allowing you to come in?
Some doctors will be comfortable dealing with COVID on the phone, but if you're really sick, if you're becoming short of breath and you need to be seen because you think something bad is happening, you might need to go to an urgent care, an emergency department, or your doctor's office because you want to be evaluated by the doctor. But if you have very mild symptoms and you're just calling your doctor because you want a prescription for Paxlovid, no, you don't need to go in there. And we don't want people that are sick, in the waiting room spreading infection. So if you can avoid going, but obviously I don't want people to delay going to the doctor if they really need to be seen by the doctor. But doctors should be able to prescribe you Paxlovid or link you to medications at the pharmacy without you having to go in unless you have symptoms that need to be seen by a doctor.
Okay.
Well, doctor, is the end of the COVID-19 pandemic in sight at all?
I think the pandemic is over, but the pandemic being over doesn't mean that COVID goes away. COVID has now transitioned to what we call an endemic disease. It's not a pandemic disease anymore. It's endemic, which means it's just regular, routine, everyday exposure that you get, just like influenza, just like RSV, just like many other infectious diseases. So we're out of that pandemic stage where hospitals were in crisis. We had shortages of this and that. It's become much less disruptive. So for all intents and purposes, the pandemic is over, but COVID-19 will never be over as long as there's humans on this planet.
Okay, can you get a flu shot and a coronavirus vaccine at the same time?
Yes, you can get both a coronavirus vaccine and a flu vaccine at the same time. It's very convenient to do so you can do that.
Okay.
Well, what is the updated COVID-19 booster shots and why should we take it?
Well, the updated booster was released several months ago, and it's updated to more closely match the version of COVID-19 that's circulating. So the version of the Omicron variant that's currently infecting people is closely related to what's in the updated vaccine. It's got a technical name, XBB 1.5, which you don't have to remember, but just know that they updated it to make it more matching, make it a better match. And again, this is something I said high-risk people should definitely take advantage of because those are the people that are getting hospitalized. And we know this vaccine does really good at preventing hospitalization. So that's why people should get lower risk people probably can, they get a really marginal benefit from it, but any high risk condition, including being overweight, including being pregnant, those are people we want to get this updated vaccine.
Is there something in our diet that we should be looking at?
Well, diet plays a role with every part of our health. I think people should eat more healthy in general, but there's not one specific ingredient. You want to make sure you get enough of your vitamins and minerals and all of that, but there's not one specific thing. People just need to eat healthier diets. They need to control their weight. We know that COVID-19 really uh, is much more severe in people who are overweight and obese. And that was one of the major problems in this country, is that we have so many people that are overweight, obese, and diabetic. COVID-19 really preyed upon them. And that has a lot to do with diet, as not everything to do with diet, but diet plays a role in that. So it is
Mhm.
important that people eat healthier and make sure they're getting the adequate amounts of the vitamins that you need to have your immune system functioning well. But there's not one specific thing that you add to your meal or anything like that.
Okay.
Okay. In your opinion, what have we learned over the past 2 years regarding the viruses? What are the things that we should be doing and the things we should not be doing?
Well, I think we learned the most thing that we've learned, and I think I probably said this the last time I was here, is that politicians really can mess things up. And that's what happened with COVID-19. That's also what happened with monkeypox or mpox to a degree, is that the politicians often make decisions that are not really the best decisions, or the most informed decisions, and they can really make things worse. And the reason that they get put in these bad positions is we're not proactive enough. That if we would have taken really decisive action with COVID-19, in the early days of 2020, in January and February of 2020, we wouldn't have been put in the same situation. Yes, we still would have had a pandemic. We still would have had people die, but we would not have had the disruptive effect of all of the shutdowns that occurred and all those blunt tools that were used. We would have had a better ability to test people. We would have had a lot more protection of nursing homes. So I think what we've learned is that you have to be proactive, that you can't be reactive when you're talking about a fast moving respiratory virus, because if you're reactive, you're going to end up failing. And that's what happened in the United States.
Hmm. Um,
So
how
are
many?
the are
Oh, go ahead. Go
I'm
ahead,
sorry,
Alice.
go ahead.
No, go ahead. That's your question.
Okay. Are people that smoke at risk for serious complications from COVID-19?
Yes, smoking is a risk factor for COVID-19 being worse, because when you smoke, it damages your airways. It damages all the defense mechanisms that you have in your throat, and it makes you and it also damages your lungs. Your lungs are always inflamed when you're smoking. So any virus, not just COVID-19, is always going to be worse in a smoker. So stopping smoking is one way to decrease your risk of COVID-19. Stopping smoking would probably be one of the best things that we could do from a population health standpoint in this country, is to get people to stop smoking, not just for COVID-19, but also for influenza, for emphysema, for lung cancer, for a whole host of other cancers, for cardiovascular disease as well.
Hmm.
Okay, I did have another question. It's about long COVID. What are the symptoms and how long does long COVID last?
So long COVID refers to people who have had COVID, and then after 3 months, they still have symptoms that include fatigue, exercise intolerance, maybe brain fog. They have difficulty concentrating. They just aren't back to their baseline. And we don't know how long it lasts. People do get better over time, but long COVID is a bit of a mystery. And we're just sort of scratching the surface of understanding who's at risk for it, what's going on in the person's body when they get it, and how do we actually treat it. So it's something that we have to stay tuned for, because this is not something that we have all the answers to right now. But we know that there is a small segment of the population, 5 to 10% of people probably, that get COVID, that develop long COVID and have symptoms that last more than 3 months. And it can be quite debilitating for certain people. And this is a major priority, to try and unravel these mysteries.
Hmm. So can children
Um,
receive
Go ahead.
okay, can children receive the COVID-19 booster dose?
Yes,
And if
children
so,
can
at
receive
what age?
Children can receive the COVID-19 booster shot at any age above 6 months. They can get, it can be part of the routine childhood immunization. Again, so the booster shot is safe for anybody to get. I think the benefit is concentrated in those individuals with risk factors for severe disease. But yes, children can get the booster shot if they want it.
Okay.
Okay, how many doses, how many booster shot doses of vaccine should we actually get?
It all depends on your risk factors for severe disease. So someone like me probably doesn't get much benefit from the boosters. I'm 48. I don't have any major risk factors for severe disease. But someone that's above the age of 65, they may need to get one every 6 months. So it all depends upon what your risk factors are. It's not one size fits all. It's all dependent on kind of precision guided recommendations for people based on their risk factors for severe disease. So it's not going to be the same for each person.
Okay. Should we still report COVID-19 side effects?
I do think it's important to tell your doctor and report COVID-19 side effects. People are tracking all of this, and it is important for future study to really understand both what COVID-19 can do and what the vaccine does and what side effects people may occur, because that helps us understand the whole risk benefit calculation. So I do think it is important to keep track of those types of things and to report them.
Mhm, mhm. So does any of the COVID-19 vaccines contain a live form of the SARS-CoV-2?
No, none of the vaccines that are used in the United States have live virus in them. They are all component vaccines, just have the spike protein or the genetic material of the spike protein. They are not live. They're not live vaccines. The chickenpox vaccine, the shingles vaccine, those are live vaccines. The COVID vaccines are not live vaccines.
Hmm.
Can the SARS virus be transmitted by blood transfusion?
It would be very rare if it could. It's mostly a respiratory virus, but biologically, there probably is a very small chance of that happening, but it's not usually the case that it would be transmitted that way.
Hmm. Well, can the COVID-19 vaccine cause infertility in women?
No, the COVID vaccine has not been linked to infertility. Actually, in the clinical trial of the vaccine, women got pregnant during the trial. So no, the COVID vaccine has no impact on fertility.
What about men?
No, there's no evidence that COVID-19 vaccine decreases their fertility.
Oh, okay.
Okay. Is it safe to donate blood during the COVID-19 pandemic?
Yes, it is safe to donate blood during the COVID-19 pandemic. We actually wanted people's blood that had COVID-19 so they could get their antibodies, and they helped to develop some treatments from that. So yes, it was safe to donate blood during the COVID-19 pandemic.
Hmm. So are antibiotics effective in preventing or treating COVID-19?
No, antibiotics are not effective against treating COVID-19. COVID-19 is caused by a virus. Antibiotics are what we use against bacteria. So what is effective are antivirals like Paxlovid, which I mentioned earlier. There's another one called Lagreivio or Molnupiravir is its other name. So it's antivirals that we use against viruses. Antibiotics are what we use against bacteria.
Well, do we need to be concerned, or should we expect another variant of the COVID-19 virus?
We're always going to see new variants of the COVID-19. That's what evolution does. That's what viruses do. They continue to mutate. New variants are going to come and go. They're going to come up and down. One is going to replace another one. That's always going to be happening, just like it does with any other respiratory virus. But I don't think that they're cause for worry because we have so much immunity in the population. And yes, you might get infected with the new variant, but it's going to become less and less likely to cause severe disease in a population that has so much immunity from vaccines and has antivirals as well. So yes, these variants are going to come and go forever, but they become increasingly less important because of the immunity in the population and the tools that we have to fight them.
Mm-hmm. Okay.
Okay. Doctor, wanted to know if there was anything else you wanted to share with us before we end this program today.
No, I think these have been great questions. I think it's important that we continue to answer these questions because this is a virus that's going to be with us forever. And right now, we still see about 1,500 people every week in this country die from COVID-19. And those are preventable deaths if people were vaccinated, if people were getting antiviral drugs like Paxlovid, these wouldn't happen. So it's really important that people think about that. The same is true for RSV, that there are new vaccines available for people above the age of 60 and for pregnant women. And it's important that we get more people vaccinated against RSV and decrease its burden as well. So these are really important factors that affect the health of a community. And the more control we have of infectious disease, the more people are able to go and live their lives and be free from these diseases. And I think that's a great thing and really a testament to the power of science and medicine.
A caller on the line asked a question. If you miss a booster shot, when is the best time to get the next shot?
As soon as possible. If you miss one, you can go tomorrow.
Okay.
Mm-hmm.
Go ahead, Alice. You had another question?
No, I'm just wondering, you're saying that we're always going to be dealing with something like this. So how long does it take the medical community to develop shots and develop medication to address the issues?
Well, it all depends upon what the target is. With COVID, we had the fastest vaccine program ever, less than a year, which is really astonishing and really, really excellent. I mean, that's what we want to emulate. They actually want to get it even faster. But there are some viruses that we don't have any vaccines for. So you think about like hepatitis C or HIV, decades and decades and decades have gone by and we don't have a vaccine. So it all depends on what you're talking about. With COVID, we went very fast because there's a lot of resources and it was an easier target. But some viruses might not be that easy. Our flu vaccines aren't that great, and we've had a flu vaccine since the 1940s. And as I said, some vaccines are very, very difficult to make. People predicted we'd have an HIV vaccine in the 1980s, but now it's 2024 and there's not. So it all depends on the biology. Not every virus is easy to tackle.
Okay, there's another call that came through from a caller. Could you take Paxlovid and a booster shot at the same time?
No, you shouldn't, because you'd only be taking Paxlovid if you were sick, if you were infected with COVID. So the booster shot is not something you should be getting when you're acutely ill with COVID. If you have COVID, Paxlovid is what you need. You can wait down the line and get a booster several months later. But no, you shouldn't be taking a booster and Paxlovid at the same time. The booster doesn't treat COVID. It's to prevent you from getting severe disease. So that's separate. So if you already have COVID, Paxlovid is what you should be looking for.
Okay. In your opinion, how did this all occur? It just seemed like one day COVID appeared and took over the world.
So what we know is that coronaviruses have always been around for a long, long time. And there have been some more dangerous coronaviruses that have jumped from animals to humans. So what happened was in the fall of 2019, this virus somehow made its way from bats. Bats are the natural host into humans in the area near Wuhan, China. And it was mixed in with all of the other respiratory viruses like influenza. And it didn't really start to get noticed until December of 2019. And by that time, the virus had already spread outside of China. Even though we were only hearing about China, it was already in Europe by that time. Small number of cases. So what happened was somehow this virus from bats found its way into humans. And there's a couple of different hypotheses. One is that this seafood market in Wuhan, where it's a live market, it's a wet market where there's live animals there and people pick what they want for dinner and that animal is butchered on site. That some exotic animal exposed people. That animal had gotten the virus from bats, but we don't know what that animal is. The other thing, people have also talked about what was going on in the laboratories in China and whether there was an accident there and somebody got infected with a virus. We don't know the answer to that. The Chinese government doesn't want anybody to know either answer. They've been very non-transparent, but that's how it started. Was this virus from bats got its way into humans and was able to transmit efficiently from person to person. And when you have a respiratory virus that can spread from person to person efficiently, it's going to cause a pandemic.
Okay. So when you're traveling out of the country, should you get your booster shots? Should you get shots or anything before you travel?
Well, it depends on where you're going. I would think if you're high risk for COVID, you should be getting your booster anyway.
Okay.
If you're low risk, it might be worthwhile to get a booster because it might prevent you from getting sick in the next couple of weeks if you don't want it to ruin your vacation. But it's only kind of a minimal benefit in prevention of infection that only lasts for several weeks to a couple of months that it might prevent you. But when you're traveling to other places, you also might need other vaccines. You might need hepatitis A vaccines or yellow fever vaccines or typhoid vaccines. So it's important to talk to your doctor when you're going on travel to make sure that you have the correct vaccines for the place you're going.
Okay.
So,
Well,
so
before we thank our guests for appearing on our program, we would like to say that the Good Health Women's Immunization Network, Good Health Wins, is our commitment to building an army of good health champions. Our goal is to increase vaccination rates, help remove barriers, and increase access to vaccines and good health.
and Dr. Adelja, we want to thank you for taking the time out of your busy schedule. I know you're busy to inform our audience about COVID-19 updates. You've been very informed, very
Yes,
good information.
Well,
Yes.
thank you anytime. And I'm glad that you're doing these types of programs because there's a lot of information. And I like to make sure that information gets out there to the public. There's lots of misinformation out there. And I like to be a source where people can get unvarnished information from a doctor.
Mhm.
Thank you so very much. And we also like to thank our listening audience for tuning in. And we invite you to join the National Council of Negro Women by calling 412-867-9641 for a membership brochure. We also like to tell you about our Legacy Luncheon, which is taking place on March 23rd. We are honoring community trailblazers over the age of 80. So if you want to come to that event, please call 412-418-3691. And one more thing we need to talk about is scholarships. We have scholarships for high school and non-traditional age students. And in order to find out more about those scholarships, please dial 412-979-9685. We thank you all for tuning in today. And remember, our live programs air on the first Friday of every month at 6 o'clock. Everybody, please remember to get vaccinated. Thank you so much for tuning in tonight. Thank you, Doctor.
Thank you. Bye.